have taught this Buddhist psychology class. I'll give you just a really brief history of that. So I was a graduate student at UC Berkeley, studying psychology and studying really how brain damage influenced the mind. So that's kind of what my roots were. But when I was an undergraduate up in Canada, I had the good fortune of going to school at the University of Calgary, where there was a really great group of Buddhist scholars at the University of Calgary. So you wouldn't think that that would be very likely, but it turns out that Calgary, it's a bit like Denver, and Tibetans actually like that kind of area. It's quite similar to Tibet. So we had a number of Tibetans that kind of settled in that area. So I had no idea at the time how lucky I was to have exposure to these great teachers. But I got very interested in Buddhism. And then when I moved to Berkeley, there was a great psychology professor there named Eleanor Rosch. And Professor Rosch did really seminal work in categorization, a lot of cognitive psychology kinds of ideas, but she also was a long-term practitioner of Buddhism, and she taught a big undergraduate Buddhist psychology class that had about 120 people in it usually. And because I was familiar with Buddhism, I got to be her teaching assistant a number of times. And so when I got to Northwestern, and they started doing these advising linked freshman seminars that are really writing classes, right? You want to be sure that people are writing well, but the topic could be anything. I thought, well, what a great kind of venue for something like this, because it's a small discussion group, and that's great for that kind of teaching. So that's how I started teaching this class. And it's not really directly tied to my research, but it's something I've been doing for a really long time. And so I think about my research and I think about these ideas together a lot of the time. So what I want to talk to you about tonight a little bit is just these ideas of meditation and mindfulness. And we see this everywhere. I took out some of the slides of headlines from all over the place, but as I've indicated kind of here, all sorts of different publications have done big stories on mindfulness and meditation. So there's a lot of hype about it. If you believe everything you read, you would think that there's nothing that meditation and mindfulness can't fix, right? And that's probably a little bit of an overstatement, but we'll go through some of these ideas and figure out whether that's something. Just as an initial thing, how many people have experienced meditation of one form or another already? So most of you have. We're going to do a very brief meditation as part of what we're doing here tonight, too. So I think one of the reasons that we're seeing all of this interest in mindfulness is it's an antidote to this other big problem that we're facing right now, and this is this constant type of distraction. So as more and more technology kind of infiltrates our lives, we feel very stressed. There's always someone coming after us, wanting our attention. I know especially the students that I teach and my own kids are dealing with situations where even if a friend texts them in the middle of the night, they feel there's an obligation to respond to a text right away because your friends will think you don't care about them if you're delayed for an hour or two. My kids get very frustrated because I do have a cell phone, but I rarely answer it. It's one of those kinds of things. So I am a different generation than that, but we're all feeling this stress and pressure of a very rapidly paced life. And I do like these two signs, the weapons of mass distraction, and the sign being a distraction as well. But, these other images of people on their phones in their cars, right, are really, sadly, not uncommon at all. And airports look like that too, where you look around the waiting room and you see everybody on their phones. So let's first talk about what are meditation and mindfulness. And they're related concepts, but they're not really the same thing. So mindfulness, I would say, is first of all something that is really important for meditation, but is not something that you're only doing when you're sitting in meditation. It's something that you incorporate throughout your life, especially for someone, if they were a Buddhist practitioner, they would be trying to learn how to be mindful all the time. And that's a little bit difficult. So we're going to talk about how they're related, what's going on sort of psychologically with these things and what changes might be happening in the brain a little bit. How do meditation and mindfulness relate to other forms of training? And I'll basically be saying that these are cultivating habits just like any other kind of habit. So if you think about learning to play a musical instrument, it's something that isn't easy when you first start it. You get better at it with practice. The more you practice, the better you get at it. And if you want to stay good at it, you have to keep practicing it. So it's not something like, we might think of riding a bicycle as kind of an exception. You learn how to ride a bicycle. You have to relearn a little bit if you haven't ridden for 10 years or something like that, but it does come back. It's not that hard, right? But if you think of someone being an expert musician or a highly skilled dancer or an athlete, anything like that, it takes training and it takes lots of effort and it takes practice to stay there. And if you stop practicing, you kind of regress, and you might still be able to perform, but you're not going to be at the level you were. And my colleague was a very skilled skier when he was a young man, and he doesn't really like skiing now because he says, oh, well, I'm not good anymore, right? So sometimes we give things up for that reason, and it's too much trouble to go back. Okay, so mindfulness is an aspect of the way we use our minds that's related to paying attention. So it's not just paying attention, though, it's about how we pay attention. So how do we relate to our experience after we're paying attention? So the usual definition of mindfulness is that it's a present moment awareness that's non-judgmental. And so present moment awareness means instead of mentally time traveling or mind wandering, something that we actually do a whole lot. So this is one of the interesting things about a meditation practice. If you start doing one, you start realizing how often you're somewhere else instead of being here. So that's the present moment stuff is being here right now. The non-judgmental aspect of that is noticing what's happening around you without either kind of chasing it. So we have this tendency in Buddhism, there's these fundamental ways that we relate to our experience. So if something comes up, we might find it interesting, pleasant, and there's like, ooh, this kind of leaning in, almost wanting to grab it. Or it's something that's unpleasant, and we don't like it, and then we want to push it away and reject it. And those two are kind of closely related to one another. There's a third one that's basically kind of ignorance is called, but it's like a boredom or indifference. So something happens, and it's just not interesting to us one way or another, and we don't even really pay any attention to it at all. So that's, in some ways, a very interesting one to notice because it's hard to catch. So we're not being judgmental about our experience. So in meditation, for example, if a thought comes up, you're not thinking, oh, this is a nice thought. We're thinking, oh, that's a disturbing thought. It's just a thought. Same thing with the sensations. You're like, oh, that's a pleasant feeling. That's an unpleasant feeling. You don't worry about that. A pain is just a pain. It's a sensation. So we try and be with it without pushing it away. And there's some interesting dynamics that happen as a consequence of that when you're not actually feeding a lot of extra energy into your relationship with your experience of that moment. So when you're practicing mindfulness, especially in meditation, that's one of the things that you would do without the judgment. And so the remembering to be mindful is another component of this. Like, okay, now that I've noticed this experience, how do I relate to that? So remembering that. And there's a story about a woman. I think it's an ancient story from the Buddhist literature that's about a woman, a wealthy woman who's got a guy who's guarding her house, essentially, and she's going out for the evening, and she says, now I want you to be mindful and watch the house while I'm out. And she goes out, she comes back and discovers the house is being robbed, and so she talks to her watchman and says, what happened? And he said, well, I mindfully watched the robbers go into the house, and I mindfully watched them leave again, right? So that's kind of the example of not doing it in the right way, exactly. So mindfulness is something that's important for developing a focus and stability in meditation. So this is an aspect of what you do in meditation. So when we, in a few minutes, try some meditation, you can notice this. So I sit in meditation, I maybe decide that I'm going to focus on my breath. That's what I'm going to do is pay my attention there. Breath's not very interesting. It's one of those things that's kind of boring. So pretty quickly, your mind is going to wander and it goes off somewhere else. It can wander pretty far away sometimes before we catch it. But when we do catch it, that's the mindfulness component that's coming in. So you're going like, oh, right, I was trying to do this other thing. We bring our attention back, move back to the breath, just letting go of whatever it is that's the distraction and coming back. And so that's the mindfulness component. It's kind of like the vigilance, watching what your mind is doing. And it's a little bit related to, if we say to a young child in church or in a formal sort of situation, be mindful of where you are. That's like remembering what it is we're supposed to be doing. So that aspect is lost sometimes in the definitions, that there's a memory component to this as well, not just this present moment awareness, because just being in the present and not doing anything with what's going on is probably not so helpful. And the other thing about mindfulness here and meditative concentration is these both require training our minds, because they're not really, for most of us, the way we're naturally acting. We are distracted, we do wander, and it takes practice to do it. So one of the things in any kind of basic meditation practice is being willing to keep trying. And one of the other things I'll just note here that's quite important is to try and do this without having much in the way of expectations for what the experience would be like. So if you have a really fixed idea, like, I'm going to meditate, it's going to be really relaxing, I'm going to really enjoy it, I can pretty much guarantee that you're going to find it really frustrating, okay? And if you notice that you're frustrated, that's a really good signal that you're coming to the practice expecting certain things from it. And what you're experiencing isn't lining up with your expectations. That's where the frustration comes from, right? So really the appropriate attitude to bring to this is one of like curiosity and openness. We've had our minds for a really long time, but most of us don't know very much about them. So we haven't really taken the time to have that sort of direct experience of what's going on in our own minds. And so if you go into that with more of an attitude of curiosity, like, what the heck's going on there, right? Then it's a pretty exciting experience, and you shouldn't really have too much frustration, because whatever it is that your mind kind of offers up is what your mind does. And it's fine, just the way it is. So that's the non-judgmental component of it. You know, even if you have a nasty thought about someone, it's actually just a thought, right? It's just mind doing something. You're not acting on it. So this is one of the advantages of like a sitting practice, is it gives you the opportunity to become familiar with how your mind operates without needing to interact in the environment or with other people. So meditation, on the other hand, we had a little conversation before we met tonight, and meditation's actually not the word that's used in the Asian traditions where we think of meditation as coming from. So meditation really comes from a Christian contemplative background. So it's meditative prayer, contemplating different theological situations, that kind of thing, in the West. The practices that we call meditation in Tibetan in particular would be really described more as mind training, familiarization, habit creation, things like that. So it's not sitting there mindlessly. It's not sitting there trying to strive to be empty-headed. You're not really trying to make your mind be anything different than it actually is already. But one of the things that does happen is when we sit in meditation, when we're quiet for a little bit of period of time, all of this kind of chaos of the mental activity does sort of settle down eventually. So most of the time it won't be really busy and chaotic. And as that settling kind of happens, you become more used to sitting, and you become more used to focusing your mind on whatever the object of meditation is. So it can be many, many different kinds of practices. The one we're going to be doing tonight is a very common one of focusing on your breath in a meditation practice. But there are other ones. So if you don't really like sitting still in meditation, there's a very easy walking meditation practice that you can do, which is just paying attention to the feeling of contact of your feet with the floor, not going anywhere in particular, just following a path and paying attention to your feet. So that's what you're doing instead of paying attention to breath. There are also many other practices. There's one called loving kindness practice, where you're thinking about someone that you care about, or eventually all beings in the universe, and wishing that they be happy and that they be healthy and that they be safe. So we're wishing well to others. Other practices might be wishing to relieve the suffering of others. So some of these practices you could think of as being a little bit more emotional, and the type of state that you're trying to cultivate and to practice. Other practices might be for generosity. Some of them might be developing visualization abilities. So when we talk about meditation, it's not just one thing. So you can't say, well, what are the effects of meditation? It probably depends an awful lot on what's the particular practice that you're talking about, right? So that's one thing to keep in mind. If you're reading some of the popular accounts of meditation, you can ask, well, what sort of meditation were they looking at? What were people actually doing? Because you wouldn't expect that practicing the trombone would make you very good at the piano, for example, right? So you're not necessarily going to get a lot of transfer across widely different kinds of tasks. Many of these practices start with training attention, and the traditional view of this is that our minds are kind of like an oil lamp or a candle that's in a drafty place. So the flame is very unsteady. It's kind of flickering all over the place, and we're trying to use that light to investigate something or to look at a painting, for example, on the wall. And it doesn't work all that well because it's just too unstable. So the meditation training, when we're training attention, is like putting a chimney or a shade over the candle. And because you're sheltering that light from being buffeted around by circumstances, it can shine more steadily and brighter. And that's kind of what we're doing with our own minds. So we're developing that attentional stability. So now when we try to do other things with our mind, like investigate things like loving kindness and compassion and so on, your mind's not just instantly wandering, right? You sit down to do something, you have one breath. I'm going to think about compassion, but I wonder what's for dinner tonight, and oh no, I need to go and buy some milk, and all of the other kinds of mind-wandering things that happen like really, really quickly. So we're developing that stability. And different traditions will talk about whether you really have to develop the attentional stability before you do anything else. Others will do things more in tandem, because any of the practices, even if I'm trying to do a loving kindness practice, I still have to not mind wander. So I still need to be paying attention, and I still need to have that mindfulness vigilance component of saying, okay, I need to, my mind's wandered, I need to come back to the task that I am intending to do, right? Okay, so we meditate to train the mind and become familiar with its operation. We want to stabilize attention and eventually use that stabilized attention for gaining insight into our own experience. We want to cultivate particular mental and emotional states, so stable attention, generosity, compassion, kindness, and so on. There are many positive side effects of meditation that aren't necessarily the goal of meditation. So to be more relaxed, de-stress, and so on. Within the traditions that we're talking about here, those would not be the primary goals of those practices, but they're welcome side effects, right? To feel less stress in your life is a good thing. The other positive side effects, we'll get to those in a little bit, but there's some really interesting suggestions of big changes physiologically and psychologically that happen as a consequence of kind of a dedicated meditation practice. The other thing that I would note here too is I had a student who was from Korea in one of my Buddhist psychology classes, and she came back from visiting Korea, and she'd been meditating there, and the monk told her that it's not about, you're not a human doing, you're a human being. So it's about being, not about doing, and we spend a lot of our time doing. So a sitting meditation practice is one of the few times that we can just be and not be actively doing something else. And I think psychologically and neurally, there's something very interesting about just being like awake and present with your own experience and not actually trying to do anything. And if someone wants to ask a question about that, I can explain a little more of it later. Okay, so we're going to do a really quick meditation experience here. So the first thing is to find a place that's kind of quiet. This turns out to be a big problem for a lot of my university students because they have roommates, they don't have anywhere quiet. They meditate in the laundry room sometimes. Because it turns out if you're sitting quietly in a laundry room, people don't think you're weird, they just think you're waiting for your laundry, right? So they're very worried about feeling weird, right? I'm well past that now. So one of the things that you want to do in a meditation is have a stable, upright kind of position. So sitting in a chair is fine, or on the floor, but if you're sitting in a chair, you don't want to be leaning back like this. These aren't ideal chairs because they kind of tip us back a little bit, but you want to be sitting so that your back is nice and straight, and you want your feet to be nice and firmly kind of planted on the floor. So you want to feel really grounded. Same thing if you're sitting kind of cross-legged on the floor, you want your position to be stable, and you want to feel attached to the ground. So that's the first thing. Your hands can be anywhere, but often palms down on your thighs works pretty well. For your back, you really want to feel almost like there's a string of pearls. Your vertebrae are like a string of pearls, and there's a string right from the crown of your head. So it's just sort of pulling up, and then you don't want to be straining, you want to just be straight and relaxed at the same time. Your chin, you don't want it sticking out too much because that'll put strain on the back of your neck, so just pull your chin back a little bit, and that will tilt your head a bit so that it feels more balanced on the top of your spinal column. And then you can just lower your gaze so you're looking down kind of along the line of your nose. Most of the traditions that I've had experience with meditate with eyes open, but you can also meditate with eyes closed. Either work just fine. I actually find less distraction with eyes open than eyes closed, because one of the things we do is we go into kind of near dream states pretty quickly sometimes with our eyes closed. So just settle into that. And then I want you to just take one deep breath and let it go. And then just bring your attention to your breath. You can focus on the rising and falling of your chest and abdomen. Or you can focus on the sensation of the breath at your nostrils and your lip. If you notice you're hearing sounds, that's fine. You can just let go of the sounds and come back to your breath. You don't need to try to make the sounds go away. Just leave them as they are. And if you notice your mind has wandered to a thought or a feeling, a sensation, when you notice that you're no longer with the breath, just let go of whatever was distracting you and come back to the breath. The practice isn't so much staying with the breath as noticing when you're no longer there and practicing letting go and coming back. Okay, that's just a very, very brief taste of that kind of practice. So if it's a new practice to you, it's good not to start with trying to do too long a meditation. So eventually, an ideal amount of time is maybe 15 or 20 minutes at a time. You get stiff and sore if you're sitting for too much longer than that. So in a lot of meditation centers, you might meditate for 20 minutes sitting and then do 10 minutes of walking meditation and then maybe another 20 or 25 minutes of sitting meditation. So that works well. But as a beginner, 3 minutes, 5 minutes, maybe 10 minutes is a good amount of time to start, because you don't want it to be getting frustrating. So as you're building up to doing a practice like this, it's much better to have a good quality couple of minutes than to basically sit and daydream for 45 minutes and not actually be meditating and think you're meditating, right? So it's better to start like that. So it's very important. Mind wanders, let go, come back. I think this is actually one of the critical aspects of a meditation practice that transfers into improving our quality of life. When you have a pain, so someone with a chronic pain situation, the ability to experience the pain, let go of it, and come back to the present moment. Anything that's bothering us, if you have anxiety or other distressing thoughts, learning that the thoughts are just thoughts, developing an ability to, when the thought comes up, just let it go and come back to your present moment awareness. So this training of repeatedly doing this, I think, is really quite powerful in changing our relationship with our own thoughts and feelings. So they become a little bit less petrified in some ways. It starts to open them up a little bit, and you start seeing that what's going on in your mind is really just mind stuff. You know, there's nothing that substantial about it. And so we don't have to get quite so worked up about it as we sometimes do, you know, just because a thought comes up. You don't have to take that thought seriously necessarily, right? That's another thing that tends to happen, I've noticed with people who are really very experienced long-term practitioners, is they become very light. They develop a really good sense of humor. So I heard a talk more than 20 years ago, I think, by a Tibetologist named Glenn Mullen, and the title of his talk was Enlightenment as a Perfected Sense of Humor. And it was a pretty interesting talk. So you do notice, like someone like the Dalai Lama, for example, just has a great sense of humor and a great giggle, and you know, he's amused by all sorts of things. And so many people who have these well-developed practices do have this kind of lightness about them that I think is healthy for us. You know, if we stop taking ourselves so seriously, you know, we can be a bit happier. Okay, so now we're going to talk a little bit about some of the scientific studies of meditation. And I found this picture this afternoon and had to stick it in because this is Dr. Barry Curzon, who's a Buddhist monk that I met at one of the Mind and Life events that my husband and I attended. And he's a US-trained physician who's lived with the Dalai Lama's group in Dharamsala for a long time. So he's now a Tibetan Buddhist monk, but he's an interesting person for the dialogue between scientists and the meditators because he's on both sides of that street. So he has the scientific training in the West and the experience in the monastery. And another person in that category would be Mathieu Ricard, who some of you may be familiar with. He has a fantastic book called On Happiness that's not fundamentally a Buddhist book, but it's very much infused with Buddhist ideas, and partly written because there was a book by the Dalai Lama with another scientist on the art of happiness, and it was not all that well received in France. So Mathieu Ricard is also the Dalai Lama's French language translator, and they were traveling in France. And there was a lot of negativity kind of about the book. So Ricard decided that he was going to, on retreat that year, write a little rebuttal to some of the French philosophers. And I get silly sometimes and say their attitudes a little bit like, oh, who needs happiness? We piss on your happiness. You know, when everybody's happy, nothing happens, right? We don't build anything, we don't do anything when we're happy. So, and so Ricard decided, as a good son of a French philosopher, that he was going to write a rebuttal, and it ended up being, I think, a 326-page book that's really quite wonderful. And it's happiness, about life's most important skill is what he talks about. Happiness. Mathieu Ricard, so R-I-C-A-R-D. It's not on the reference list, unfortunately, I'm sorry. It's one of the books I try to get my students to read because I think, you know, it's one of those things that might make them actually happier, which is a good thing. All right, so this is Barry Curzon wired up for an EEG study of meditation. So it's a geodesic net recording electrical activity from the brain at the scalp. So we do some studies using this kind of methodology. My husband's laboratory does more. These studies, this one may have been in Wisconsin at Richie Davidson's lab. There's also some laboratories in Europe that are doing a lot of this kind of work as well. So there's many scientific studies of meditation. If you try to propose a meditation or mindfulness-based intervention now for a federal grant from the National Institutes of Health, if you went to the Institute on Complementary and Alternative Medicine, they would tell you that you needed to take your grant somewhere else because mindfulness and meditation are no longer considered alternative therapies. They're considered to be so well established that they're now conventional therapies. So there's a lot of literature in this kind of domain. We don't understand the mechanisms of these things very well yet, but of course we don't understand how aspirin works either, right? So there's lots of, as a scientist, we have endless scope for scientific discovery still. There's so many things we don't understand, especially about our own minds. So many of the studies are clinical studies. They're using interventions like mindfulness-based stress reduction or simple mindfulness techniques to try and see if you can help individuals with particular health problems. And Jon Kabat-Zinn is somebody who really started this mindfulness-based stress reduction technique. He developed it. He somewhat has it patented. He wants any MBSR facilitator to be one who's gone through his training program, ideally. But he developed it because he came back from Asia studying many of these techniques and thought as a physician that it was something that could be very helpful. And what he tried to do was kind of decontextualize the practices a little bit, sort of take them out of an Eastern religious context and make them potentially more palatable to old white guys, essentially, right? So if you're trying to do cardiac rehab in Boston in the 80s, and you bring these guys in who've had a heart attack and tell them, I want you to do these Eastern meditation practices, it's like kind of, no. I think there'd be a lot of resistance. So he developed this series of interventions that include some group therapy kinds of components, some yoga, absolutely, some body-centered practices, body scan, this kind of thing. And then also some meditation techniques, including a loving kindness sort of practice and a breath type of practice. So they're doing all of these kinds of things. And it's an 8-week program with a full day retreat and homework that you need to do, all of these kinds of things. So it's really demonstrated for a wide range of different physical ailments. One of the first things they looked at was psoriasis, actually. So they looked at skin clearance rates in individuals who either had a mindfulness-based stress reduction or a control intervention. And the control intervention was basically doing workshops about health and relaxation and things like that. And what they found is that people who went through the MBSR program actually had their skin clear up, so their immune system perhaps became less reactive to their own bodies in this kind of way. And that was one of the earliest studies that they did. They also looked to see, it was a control study where they gave some people a vaccine. Half the group got everybody got a vaccine, half of them got an MBSR intervention. The others did, again, a kind of control of general wellness information. And they just looked at how robustly the body responded to the vaccine. So this also showed that the people who were doing the mindfulness-based program actually had a more robust immune response to the vaccination. So these were the initial bits and pieces that suggested that there's something interesting going on, not just in the mind, but in the mind-body kind of relationship here through these kinds of programs. And that's been demonstrated for many, many different types of health problems, including a variety of different cancers, heart conditions, and so on. There's other interventions and investigations that are more focused on education and just improving social well-being. Richie Davidson in Madison in Wisconsin is the one who has done the work on this kindness curriculum, and there's a lot of information about this on the website, and I think a 71-page PDF sort of describing the kindness curriculum. But it's a really cool thing where they started working with kindergarten kids, or preschoolers, really, like 4- and 5-year-olds, to try and train them to be kinder and more compassionate, so actively doing this in a structured situation. And one of the things that they did to measure kindness with these kids was they used the sticker economy that little kids get into. So the kids got stickers, and at the beginning, before the intervention, they were asked to divide the stickers up between the ones for themselves, like how many am I going to keep for me, how many am I going to give to my best friend, so the child that I like the best in class, and then they used how many do you want to give to your worst friend. which is an interesting description. So it was like, how many stickers do you want to give to the child in class that you don't like, or is the one that you like the least? And as you can expect, the kids basically kept most of the stickers for themselves, and they gave some to their best friend, and their worst friend not so much, right? Then they go through this intervention where they learn about kindness, they learn a little bit about emotion regulation, paying attention, breathing to calm yourself down. One of the things they do is they have the kids lie on the ground and they put a Beanie Baby on their bellies, and they try to rock the Beanie Baby to sleep. So they use the deep diaphragmatic breathing with the little kids to try and move the Beanie Baby around. So these are the kind of interventions that they do. And then at the end of the program, or when they're measuring, they go through the sticker thing again and say, okay, now how do you want to divide the stickers up? And what they find out is they divide the stickers equally pretty much at the end. So they're feeling connected to everybody in the class. And there's some fun little descriptions of the program on the website as well, including, you know, what the kids respond when a classmate gets injured, and that they wanted to do like a loving kindness practice essentially for their friend who was hurt, right? And pass on good wishes to other people. So it's a really interesting thing. There's variants of this for teachers as well. The one that was going on in the Bay Area where they're trying to teach really loving kindness and compassion for the teachers, not just for the children as well. So there's another movement that's looking at social interventions in that kind of way. And then there's another set of studies that are really basic science investigations. So really interesting things seem to be happening as a consequence of these changes in mindfulness and meditation. And by the way, it's not like it's magic, right? Like changes happen if you become trained in music. Your brain changes when you study music and when you spend a lot of time doing that. I'm sure that people who knit a lot have changes in their brains. So it's basically whatever we do, and we do a lot of, is going to shape kind of who we are and how our brains work. So there's, you know, nothing deeply mysterious about repeated things changing things, but we're still trying to understand how exactly those things work and what's going on with meditation as well. So in this case, we might measure behavioral changes in individuals. We might use physiological measures, including the EEG measures that you saw on Barry Kurzan's head. We might measure emotion regulation, things like that. So using techniques including EEG, fMRI, some basic physiological measures, a lot of work now looking more at immunology, so looking also at hormonal changes in the body, cortisol. I'll talk about a really interesting study that looks at changes in telomerase, which is kind of an anti-aging thing. So that's pretty cool, and the older you get, the more excited you are about those anti-aging components. So that's kind of the basic science here. So there's also, as I said, this is not considered alternative anymore. Because there have been so many studies now, we're in the realm where we can actually start to do meta-analyses. So a meta-analysis is when there's a sufficient number of studies of a particular topic in science. You can start looking across those studies to see, in aggregate, what can you conclude about these practices, right? Like, is there something that's really there? Because you can imagine sometimes there's a big effect found in a study, and then somebody else might do something similar, and maybe they don't get a result at all. So the meta-analytic technique is a way of aggregating across published studies and also making some estimates of studies that never did get published. So you might imagine that there might be something that we call in science a file drawer effect. So I tried to do this thing, and I couldn't get it to work, so I just stuck the data in a drawer and it never gets published, right? So maybe it's just studies that by accident work, by chance they find an effect, and those are the only ones that get published. Maybe there's not really anything there. So these meta-analytic techniques give us a way of kind of assessing like how strong are these effects compared to, you know, other things, right? For example, you could compare something like a therapeutic technique like cognitive behavior therapy against antidepressant drugs and see, you know, how good is that? And about the same, as it turns out, for that one. So we can see these basic behavioral changes in attention and cognition. We can see mental health and well-being changing as well. So this is an example of a meta-analysis, and what's on the the x-axis at the bottom there is the effect size. So this is just a measure really of the strength of the change or the difference between a control group and a meditative group in this case. And you can see that the strongest effects are actually negative personality traits, so sort of neuroticism, worrying, ruminating, being crabby, miserable, like the kind of negative traits I might have of being grumpy, right, when you wake up in the morning, any of those kinds of things. That seems to be where the biggest effects are, that people who do these extensive meditation. And some of these will be more short-term interventions. Some of them are actually longer term, like people who are already active meditators, but pre and post a 3-month meditation retreat, for example. So you don't take people who've never meditated before and put them in a 3-month retreat. That would be a really bad idea, actually, because some people have psychotic breaks in meditation retreats, for one thing. So you want to be careful to know that you're getting the right people in that situation who can deal with it, right? But we're showing that an intensive period of practice here can make a change over a baseline of a daily practice that a lot of people might have as well. So we've got these personality traits, stress drops down, mindfulness goes up, measured intelligence, that's a weird one, right? Because that's supposed to be stable. Neuroticism, anxiety, yes?
Do they have ways of measuring these things, or would it be self-reported by the meditator?
They're reported usually through questionnaires, but some of them are going to be more like behavioral tasks. So for things like attention, it might be an experimental task that people are doing. And I'll show you an example of that in a little bit. But positive emotions, negative emotions would mostly be self-reported things. And some of them are questionnaires, others might be more like behavioral sampling, where someone's carrying a phone or a Palm Pilot or something like that around, and it buzzes. You can do it with a smartwatch these days too. So you might get a notification and then fill out a questionnaire. Like phones are really good for that because you get pinged with a questionnaire, how are you feeling right now? So that allows you to get kind of a in this moment sort of assessment rather than somebody retrospecting about, well, how did I actually feel today? And that's going to be biased by how I'm feeling recently, always, right? So the real-time sampling is good for that kind of thing. Yes?
Make a suggestion that you have this copy of
Yeah, I'm sorry that it's a bit small. Yeah, so well-being, assessed well-being, and that's just, again, a subjective report thing. And one of the things you might be thinking of is we need to be careful in some of these situations for what I might think of as demand characteristics. So especially if you've invested a lot of your time, like 3 months to do a meditation retreat or 8 weeks to do an MBSR program, you probably want it to have worked, right? So you probably don't really want to be saying like, no, I feel worse off than I did before I started and nothing has improved, right? So we need to always be mindful. That was an unintentional one. We need to remember that there are these other potentially confounding situations that might be driving some of these things. But this is one of the reasons why a meta-analysis is good, because you're looking across different detailed methods that people have used. So I'm going to go briefly through a couple of specific studies. Yes? I think they last for a little while. I'm sure people have done it. I don't know of anyone offhand, but I think you do regress, right? So it's like if you stop your practice, then you're not going to have these benefits. A lot of one of the emerging pictures is really it has a lot to do with not your lifetime practice, but how intensively have you practiced recently. And I think this is one of the reasons why you see effects of something like a 3-month retreat. So you've got people who are meditating regularly, but now they've done this intensive focused practice for a period of time, and then they get these big jumps, right? And then if you go back, presumably, to your 20 minutes a day or your hour a day, it's probably going to drift back a little bit again. That would be my expectation anyway. So we're going to go through these. An early study was showing that your brain might actually grow from doing meditation practices. It's a colleague, Sarah Lazar in Boston. Changes in immune system functioning, changes in the physiology of aging, little study in changes in attention, and then some suggestions about healthy aging and how these practices might help with that. So this is a study that Sarah Lazar did. She did a follow-up on it too that in some ways is a little stronger than this. But what she did is she brought in people who were all long-term meditators, the people who had for many years a long meditation practice, and she compared them to a control group and basically scanned their brains. And the question is, who should be the control group for long-term meditators, right? So this is a big issue for a lot of these studies. She had age-matched controls, so age and gender-matched individuals. She also had a young college sample that she compared to these, but we'll come back to that in a minute. So what she found is that these long-term meditators, in these areas of the brain that are colored there, increases in the cortical thickness. So that's the gray matter part of the brain where the active cells, as far as we know, are primarily focused, right? And these meditative practices seem to expand these cortical areas, probably by growth of connections between neurons. So not growing new neurons so much, but increasing connectivity of these brain areas within those regions. And this is quite a remarkable thing. So it was the first demonstration that you're actually changing your brain by doing this. Again, I would expect something similar, and we see some of these things like in motor areas. If you're learning to play piano and you're spending a lot of time playing the piano, you're going to see motor regions and sensory regions of the brain related to your hands developing, right? So it's not a deeply mysterious thing. It's just what we do when we're doing something a lot. So these people, these not young people, right? Because you can't be a long-term meditator without being older. You just can't have like 40 years of meditation practice and be 20. It's not possible, right? So it's mostly older individuals. So one of the things that was interesting here is these older individuals, in terms of these regions of their brains looked more like the college-aged participants than they did the age-matched controls that they were compared to. But you need to keep something in mind here. So we've got these people that are long-term meditators. And this was a study reported in 2006. So, they may have meditated for 30 years. They've been doing it for a long time. If you have an age-matched control group, which group has more vegetarians than it, do you think? The meditators. Which group uses less alcohol, probably? Meditators. Which group smokes more? Non-meditators, right? So you can start, which group might have less stress, right? Maybe the meditators have less stress. So these are the kinds of things you have to think about when you're evaluating science like this. Is it the meditation, is it the mindfulness practice, or is it all of these other things that kind of go along with it? And that's especially true when you look at the mindfulness-based stress reduction data. There's meditation and mindfulness there, but there's also kind of a group therapy aspect of it. There's building a community aspect. There's networking with people. There's a whole bushel of different things that are coming together in those practices, and those tend to be stronger than just meditation when you look at the effects of those. And it makes sense because you're combining a bunch of different things, and so they're most likely going to be effective that way, right? But we can't be too quick to say, well, just meditation without any other change would produce all of these things, because that doesn't really seem to be true. However, she did a subsequent study where instead of using long-term meditators, they actually randomly assigned people into a meditation group and a non-meditation group, and saw a much smaller effect because it was over a much shorter period of time. But suggestions that you were getting similar changes in the cortex, even people that were newly doing the meditation. So that makes us a little bit more confident that it actually had something to do with the meditation practice. This is one that I find really pretty interesting, and this is a meta-analysis. The authors here, so they were looking at a number of different studies that were looking at immune responses, and I actually find this area, it's called psychoneuroimmunology, so it's an incredibly long word, but it's mind-body interactions in terms of the functioning of the immune system and how stress really influences the functioning of that sort of system. So this is probably the vector by which meditation and mindfulness are helping, is they're allowing you to de-stress by maybe, again, not taking a lot of things as seriously as you did before, relaxing a little bit more. So there's a number of things across these studies that show up. So one consequence of meditation practices is a reduction in inflammatory processes in the body. So C-reactive protein and these other inflammatory, like cytokines, drop in people who are meditating. At the same time, the T cells, so the cells that are active, vigilantly watching for infection in the body, those go up. And then in this meta-analysis, and then I'm going to show you a little bit more detail about this, telomerase goes up. So this is kind of biological aging, stalling out, or maybe even reversing a little bit, which is very cool. So a very brief thing, and I'm not an expert in this field, but I think it's really cool. So telomeres are they're the little white dots that you see there. And so they're the caps on the chromosomes in the DNA. And these are important because transcription of the DNA sort of fails when you get too close to the end. It's like it wears off, and then you see transcription errors. So that's not a good thing. And when the telomeres disappear, then the cell death is activated, essentially to avoid errors in transcription. So one of the things that you want to avoid cell senescence and maybe aging in the body is to have kind of a robust response and replacement of the telomeres as they're wearing away. And by increasing the amount of telomerase, so this is the precursor to constructing the telomeres, when we increase that on the body, then we can have this protective influence on the DNA here. And this is something that's been shown to change in meditators. So again, this is a group of people who are doing a 3-month retreat. This was something called the Shamatha Project, where people went into this meditation retreat expecting to undergo a wide battery of physical and psychological tests before, during, and after the practice. So they knew that this was a research project, but also run by Alan Wallace, who's a former Tibetan monk and a teacher of especially the kind of attention-focused meditation that we were talking about. So these people came into the retreat, and they were measured, including having blood draws and cortisol and all of these kinds of things at the beginning and at the end of the practice. And you can see the control group was another group of people waiting to do the same thing. So this is a fairly standard waitlist control. So again, people who themselves have an active meditation process, but they're not in this intensive focused retreat. And you can see that telomerase in the blood actually goes up significantly from the beginning of the retreat to the end of the retreat. So that's pretty interesting as well. Now, keep in mind, though, that these people are away from their homes. That could be stressful, but also you don't have to look after yourself, right? You're on retreat, people are feeding you. You don't need to worry about, fighting with family or with your boss. I think it continued for a bit. I've talked to the author of this. He's a friend of mine, the lead author on this project, and they were pretty amazed, actually, by these results. Nobody really expected to find this, I think. So the fact that it's kind of coming out in meta-analyses is pretty interesting as well, that it's turning out to be kind of robust. So this might be the thing I'm most excited about. Okay, this is a really specific way of measuring attention. So it's a paradigm that I've used, so I'm comfortable talking to you guys a little bit about it. And this is something also that changed in this same 3-month retreat, pre versus post retreat. So this task is one where there's a rapid sequence of numbers, and then there's a couple of, that's wrong. Numbers and digits, those are the same thing, right? There's embedded letters in the digits, so there's 2 letters. And I'm going to show you this task, so you want to grab both of the letters if you can, right? See if you can see them. So this is the task for the individual, is that they have to report the letters. And essentially what you have to do is dive into the list, grab the first letter, let go of it, and then grab the second letter. It's almost literally like physically grabbing it, right? And attention has to be kind of carefully balanced to do this successfully. If you kind of invest too much attention, then you fail. If you don't invest attention, you also fail. So that's it. And the ERP is an event-related potential at about 300 milliseconds after the onset of the stimulus that's recorded from the scalp. And it's being used here as an index of how much effort essentially is allocated. So in the actual study, that's what they're doing. I can't see what's coming up next, so I want you to be ready to do this. Okay, focus on the screen. I'm going to try it again. A and J, yes. So if you only got one of the letters, then you wouldn't have succeeded at the task. And if you got the J, which was the second letter, but not the A, you also would not have succeeded at the task because you didn't report the first one, right? It's called an attentional blink task because quite frequently when you get the first letter, or whatever the element is, you miss the second one. So it's like you've kind of jumped in, focused your attention, and it's busy, and so it's not there for you to allocate it to the next thing. So this is the results from this experiment with meditators. So do you see up there it says, let me see if this works. Oh. I was looking for a laser pointer here. Do you see where it says P3B to T1? Okay, the top row of those little figures is at the beginning of the retreat, before the retreat starts. So you have the novices and the practitioners. The practitioners have a little bit more robust response, but there's really not very much difference between the two. At time 2, when you can see at that P3B where that arrow is pointing, the difference between that black line and the green line is the change in how much effort, essentially, the individuals have devoted to grabbing these targets. So essentially, the interpretation here is that through the retreat period, they've learned to control their attention in a little bit more of a fine-grained way. So when they're doing something like this attentional blink task, they can give just enough attention to that first target, so when the second target comes around, they still have attentional resources that are available there to grab that next target. And what you see is a consequent reduction in the amplitude of the brain activity as recorded by the EEG that's reflecting that. Does that make some sense? It's a little bit technical. They weren't practicing this task, yeah, so that's the interesting part. It's not that they were just trying to get better at this task, it was the attention training that they were doing in the retreat that's then reflected in this change in behavior. Okay. This is another one that's impossible to read, so I apologize for that. So this idea of mindfulness meditation and healthy aging, it's basically here that enhanced attention, so because your attention is better, it leads to an easier time switching from one task to another. It lets you hold more things in working memory, so we become a little bit less forgetful. You know, as I get older, I notice that I'm spacing on things occasionally. I was supposed to meet some grad students for lunch yesterday at noon, and I was busy working in my office and looked at the clock and went, oh no, it's 12:19, right? You know, we do more things like that as we get older. So your working memory, active memory capacity is better. And maybe frontal lobes are still working a little bit better too, which is kind of the regions that were where the cortical thickness was increasing with meditation practice. So you're kind of retaining those abilities to kind of orchestrate your life a little bit. Certain networks in the brain seem to be maintained a little bit better in meditators. We can maybe post these slides somewhere on the website, so you'll be able to take a look at them. improved psychological well-being, including decreased loneliness. So if you're thinking about how you're interconnected with people through some of the meditation practices, that helps to buffer you a little bit from feeling isolated and alone, because you realize that you're not really a separate individual in certain ways. So as a consequence of that, we feel more integrated. And then, as I mentioned before, some of these changes in immune system functioning, including decreased inflammation and the telomerase increases and things like that. So all of these things might lead to healthier aging in normal individuals. So the question then is, should you meditate or shouldn't you? Well, yeah, some results are correlational. Some things might be explained by other things than meditation, like social groups or changes in diet and so on. So is meditation doing it? Is mindfulness doing it? Jury's a little bit out on that still. You know, it's suggestive that it's happening, but we won't leap to a conclusion. I'm a scientist, so I'm not going to say absolutely that's true. But the counter side of that is meditation is actually really pretty easy to do. Like, the instruction that I gave you tonight is enough that you could go on and develop a perfectly robust meditation practice of your own just from that simple instruction. You don't really have to pay much for it. You don't need a lot of equipment for it, like anywhere you can sit down, a chair, a floor. You don't even need a chair to do it, right? So it's not an expensive thing to take on. And it's generally pretty harmless. Somebody who's has serious psychological problems, intensive retreats are maybe not such a good idea with sleep disruption and things like that. That can be a little dicey, but for most of us, these kinds of practices are essentially harmless at worst, right? And some of the results that tend to come about fairly quickly from a meditation practice include things like stress reduction, improved sleep, and I would say a general reduction in what I call zombieism, which is, you know, the staggering around looking at the cell phone, right? So given that, why not try? Thank you.